Tonight we're going to talk about Saxagliptin, cardiovascular outcomes in patients with type 2 diabetes. What is diabetes type 2? Diabetes is a problem with your body that causes blood glucose, sugar levels to rise higher than normal. This is also called hyperglycemia. Type 2 diabetes is most common from diabetes. If you have type 2 diabetes, your body does not use insulin properly. This is called insulin resistance. At first, your pancreas makes extra insulin to make it up for it, but over time, it isn't able to keep up and can make enough insulin to keep your blood glucose at normal levels. Here's the video.
Type 2 diabetes is a condition in which your blood sugar level is too high. After you eat foods that contain carbohydrates, chemicals in your small intestine break them down into single sugar molecules called glucose. Next, the cells lining your small intestine absorb the glucose, which passes into the bloodstream. When the blood reaches your pancreas, beta cells inside the pancreas detect the rising glucose levels. To reduce the glucose level, your beta cells release insulin into your bloodstream. As the blood circulates through your body, the insulin and glucose exit the bloodstream into your tissues to reach your body's cells. Most cells of the body have certain receptors on their surface that bind to the circulating insulin. Insulin acts like a key in a lock to open up the cell so that the circulating glucose can get inside the cell. Now your cell can use the glucose to produce the energy it needs to function properly. If you have type 2 diabetes, either your pancreas does not produce enough insulin, or your body cells resist its effects, or both. If you have insulin resistance, your insulin cannot unlock the cells to let glucose in, because the locks, called receptors, are abnormal or missing. As a result, glucose is locked out of your cells. Consequently, the amount of glucose builds up in your bloodstream in a condition called hyperglycemia. To compensate for hyperglycemia, your pancreas produces more and more insulin. Your overworked beta cells try to keep up with the demand, but gradually lose their ability to produce enough insulin. Due to hyperglycemia and the lack of insulin, you may experience the following classic symptoms of diabetes: excessive hunger, excessive thirst, increased urine volume, and unexplained weight loss. Symptoms of type 2 diabetes that may appear over time include fatigue, recurrent infections, changes in vision, itching, and tingling or prickling sensations in your skin. Life-threatening complications of type 2 diabetes include diabetic ketoacidosis, hyperosmolar hyperglycemic non-ketotic syndrome, and hypoglycemia. If you don't receive treatment for hyperglycemia, diabetic ketoacidosis can result. Because you no longer have enough insulin circulating in your blood, your cells can't get the glucose they need to produce energy. As a result, your body turns to fats and proteins as an alternative source of energy. During the fat breakdown process, certain byproducts, known as ketone bodies, accumulate in your blood, resulting in a condition called ketosis. If ketones build up to dangerously high levels in your bloodstream, you may develop diabetic ketoacidosis, or DKA, which can lead to coma and death. Another complication resulting from failure to treat hyperglycemia is called hyperosmolar hyperglycemic non-ketotic syndrome, or HHNS. As the insulin deficiency continues, your blood glucose level increases. In response, your kidneys filter excess glucose out of the blood into urine, along with large amounts of water. Unless you consume large amounts of water, your kidneys cannot keep up with the demand of removing the glucose from your bloodstream and diluting it sufficiently in urine. As a result, your blood becomes much more concentrated than normal, a condition called hyperosmolarity. Hyperosmolarity pulls water out of your body tissues into your bloodstream, causing severe dehydration, which may lead to hyperosmolar hyperglycemic non-ketotic syndrome. Neurological symptoms, such as seizures and coma, can occur. If you take an excessive dose of diabetic medication, you may experience an acute complication called hypoglycemia or insulin shock. Excessive insulin or oral hypoglycemic medication causes too much glucose to go into cells, leaving an insufficient amount in your bloodstream. Certain organs, such as the brain, need a constant energy supply to function properly. Because the brain's primary source of energy is glucose, it is the first organ affected by lower glucose levels. When your brain cells, called neurons, are starved for glucose, they start to malfunction, causing symptoms such as nervousness, shakiness, and confusion. If your glucose level continues to drop, the electrical activity of your neurons diminishes significantly, resulting in seizures or diabetic coma. Over time, chronic, poorly controlled type 2 diabetes can cause degenerative tissue damage, resulting in long-term complications such as atherosclerosis, blindness, neuropathy, and renal failure. To avoid the complications of type 2 diabetes, you can take steps to keep your glucose level within a normal range, using a combination of blood glucose monitoring, a healthy diet, regular exercise, and medications as necessary. You will need to check the level of glucose in your blood frequently with a glucometer. To do this, you will prick your finger with a small needle called a lancet and place a drop of blood on the strip attached to the glucometer. Based on your blood glucose level, you may need to adjust your meals, physical activity, or medication dose. Eating a healthy diet will help to lower your glucose level when you eat a diet rich in fruits, vegetables, and whole grains, have meals and snacks about the same time every day, consume the right balance of carbohydrates, proteins, and fats, and minimize your intake of high-sugar foods. Getting regular exercise, even just 30 minutes a day, will lower your blood glucose level, decrease insulin resistance, and may lead to weight loss. You may need to take one or more diabetic medications to help lower blood glucose. Some of these medications increase insulin production in your pancreas. Others decrease insulin resistance in your skeletal muscles. Some treatments increase insulin sensitivity in certain tissues. Others promote a slight decrease in absorption of glucose in your digestive system. If your type 2 diabetes cannot be controlled with diet, exercise, and oral medications, your doctor may prescribe insulin and train you to inject it just under your skin. By treating and controlling your blood glucose level, you may prevent the occurrence of complications from type 2 diabetes.
Now, the causes. As the video said, pancreas does not produce enough insulin, cells resist the insulin, or both. Saxagliptin is a drug used to treat diabetes type 2. It is not used for type 1. It inhibits the peptidase for increasing the insulin levels when the glycemia is high after every meal. Here's other video.
Incretins and type 2 diabetes, discovering a new piece of the puzzle. In today's modern society, the dramatic increase in patients with type 2 diabetes indicates that an unchecked global epidemic is at hand. Pathophysiology, digestion and diabetes. Glucose is the basic fuel for the cells in the body and is provided, in part, through the process of digesting the foods we eat. During digestion, the hormone insulin is released by beta cells in the islets of Langerhans of the pancreas. Insulin acts as a cellular key, allowing the passage of glucose from the bloodstream into the cells of the body. In patients with type 2 diabetes, the amount of insulin produced by the beta cells is often insufficient. Another important hormone of the pancreas is called glucagon. Glucagon is synthesized and released by alpha cells, also located in the islets of Langerhans. When glucose levels are low and metabolic fuel is needed to avoid hypoglycemia, glucagon stimulates the liver to release glucose, which has been stored as glycogen. A closer look into the mechanisms that regulate beta cell production of insulin reveals that the ingestion of food causes the release of substances from the gastrointestinal tract. These substances include hormones called incretins. Two important incretins are glucose-dependent insulinotropic polypeptide, or GIP, which is released from K cells in the duodenum, and glucagon-like peptide 1, or GLP-1, which is released from L cells in the ileum and colon. In the pancreas, both incretins have been shown to stimulate an insulin response from beta cells. Incretins in type 2 diabetes. It has been observed that the production of the incretin hormone GLP-1 after a meal is reduced in patients with type 2 diabetes. Since GLP-1 levels are reduced in persons with type 2 diabetes, the insulin-regulating effect on beta cell function may also be compromised. With GIP, however, the ability of beta cells to mount an insulin response is substantially reduced. Glucagon release from the alpha cells of the pancreas is suppressed by GLP-1, thereby reducing hepatic glucose output. The incretin mechanism is highly glucose-dependent, as illustrated by a study where GLP-1 was introduced in patients with type 2 diabetes. When glucose levels were high, GLP-1 increased insulin. However, once blood glucose levels fell, insulin levels returned to baseline, thus demonstrating the unique glucose-dependent mechanism of incretins. Experimental data from animal and in vitro models suggest that incretins also stimulate insulin biosynthesis. These studies have shown an increase in the number of beta cells resulting from proliferation, while also showing a decrease in cell death, or apoptosis. These findings have not yet been confirmed in humans. DPP-4, an enzyme that degrades incretins. Dipeptidyl peptidase 4, or DPP-4, is an enzyme that degrades the incretins GLP-1 and GIP. DPP-4 exists in both membrane-bound form on the external surface of various cells and is also found throughout the plasma in soluble form. Most incretin breakdown by DPP-4 is believed to occur in the capillaries which surround the incretin-producing cells in the intestine. Less than 2 minutes after GLP-1 formation, DPP-4 quickly degrades GLP-1 by cleaving off 2 terminal amino acids. In a similar way, GIP is also rapidly degraded. The inhibition of DPP-4. A possible solution to the rapid degradation of the incretins by DPP-4 was through the administration of a DPP-4 inhibitor. In clinical studies, DPP-4 inhibition has been shown to increase levels of intact incretins, thus increasing insulin and decreasing glucagon. This resulted in improved glycemic control without increased risk of hypoglycemia or weight gain. The inhibition of DPP-4 represents a promising new strategy for the treatment of type 2 diabetes.
Okay, benefits. The benefits of this treatment in patients treated with Saxagliptin have a significantly lower rate of major adverse cardiovascular events than did control patients. Improved the glycemic index, and Saxagliptin reduced the development of progression of microalbuminuria. Here's
Type 2 diabetes symptoms. Diabetes warning signs. Type 2 diabetes symptoms worth knowing. Any of the following warning signs could be one of the type 2 diabetes symptoms. You could experience one or more of the following diabetes signs or symptoms, or you may not experience any early symptoms at all. A great number of folks never experience any symptoms of type 2 diabetes and are surprised when they are diagnosed by a routine blood test during an annual physical. Type 2 diabetes symptoms can be rather vague, such as being more tired than usual, or always feeling hungry between meals and craving sweets for a pick-me-up. These diabetes symptoms could be written off as stress or blamed on the demanding job. These early diabetes symptoms attributed to diabetes are more constant and pronounced than merely reaching for a couple of cookies occasionally between meals or being tired after a hard day. 10 type 2 diabetes symptoms checklist. Increased hunger and craving sweets. Extreme thirst. Frequent urination. Weight gain. Fatigue and drowsiness. Blurry vision. Slow healing wounds, sores, or bruises. Dry, itchy skin. Tingling or numbness in the hands or feet. Frequent or recurring skin, gum, bladder, or yeast infections. One of the specific symptoms of type 2 diabetes is having patches of dark, velvety skin in the folds and creases of their bodies, usually in the neck or armpits. This condition, called acanthosis nigricans, may be a sign of insulin resistance. Type 2 diabetes rates are growing dramatically in the United States and Western Europe. Type 2 diabetes is a slow progressing disease that begins a long time before the actual diabetes diagnosis. Type 2 is the result of the muscles and other tissues of the body developing a resistance to insulin produced by the pancreas. Initially, the pancreas tries to overcome this resistance to insulin by making more insulin. The blood sugar level goes up as a patient's body is no longer able to make enough insulin to counter-react to gradually increasing insulin resistance. This form of disease generally strikes the over 45 age group, although younger ages can be affected. In comparison, type 1 diabetes results from an autoimmune reaction in which one's own body attacks and destroys the beta cells of the pancreas. These are the cells that normally produce insulin. Type 1 diabetes is a disease in which the patient, in a relatively short time, has no insulin production. Since type 1 diabetes often strikes children, this form of disease is commonly referred to as insulin-dependent or juvenile diabetes. How develop type 2 diabetes symptoms? Keep in mind, type 2 diabetes symptoms develop slowly and are usually produced by weight gain, especially in the abdominal region. Think apple-shaped body. Obesity and lack of exercise are closely linked to type 2 diabetes. Type 2 diabetes is generally preventable. If you are over 45, have an apple-shaped body, and have a family history of diabetes, talk to your doctor about proper diet, weight loss, and an appropriate exercise program. Taking preventative action can help you avoid type 2 diabetes symptoms.
For the latest
Conclusion: using Saxagliptin is a way to control the glycemia. It is effective, but it keeps ongoing studies. These drugs make its job. Nevertheless, the benefits are not better than other drugs, and it doesn't have enough research to confirm that the benefits of the drugs are greater than the risks.